Hello, everybody. Thank you for joining us today. I'm Kathy Rowe, the Executive Director of New Jersey Advocates for Aging Well. And today I'd like to welcome Dr. Michelle Zechner, Assistant Professor at the Rutgers School of Health Professions, Department of Psychiatric Rehabilitation and Counseling Professions. And I know that's quite a mouthful, Michelle, but I think it reflects how much you do. Dr. Zechner has an extensive career in psychiatric rehabilitation, research, professional training, and more. Her primary expertise is in helping people living with lifelong mental health conditions focus on health and wellness, and in wellness for emotional health as we age. So Dr. Zechner, we are very happy to have you with us here today. And with that, I am going to turn everything over to you.
Thanks so much, Kathy, and welcome everyone. I'm so grateful you could be here today to talk about this topic that, as I was saying to Kathy, I love to talk about, and I could talk about always and ever, which is wellness for when as we age and at any time in our life. So I've got 4 objectives that I'm hoping we'll talk about today. And one is to talk about this idea of multidimensional wellness. The second is to review a model for wellness, a model of wellness for emotional well-being. And then I'd like to talk a little bit about some practical suggestions and applications based on some work that I've done recently with some colleagues. And lastly, I'm hoping that we have time to share and discuss ideas about how this might apply in your work, and how to consider wellness for the population that you're supporting and helping. So first off, I guess I'd like to ask you to put in the chat, if you like, if you are familiar with multidimensional wellness and if it's something that you talk about in the practices that you have. So you can just drop that in the chat. If you know something about wellness or use wellness in your practice now, I'd love to know it. And thank you. Even if you don't, that's a great information for me as well. So let's start with what is wellness. Now, one of my mentors, Dr. Peggy Swarbrick, I've worked with for about 15 years on the idea of multidimensional wellness, and her work is really focused on people living with mental health conditions. But I really have ingrained it and really thought about it for older adults in particular. But I like what Peggy says about wellness, in particular, that it is a conscious, deliberate process, meaning we choose wellness, and that it requires a person to become more aware and also to make choices every day that lead to improved.
New Jersey.
Oh, I'd ask if you wouldn't mind, if you're not speaking, if you could mute yourself, that would be really helpful. Thank you very much. I know that's a little bit challenging. Okay, so wellness is that, as I said, a conscious choice. It also asks people to do a little bit of reflection, a little more awareness of themselves, to think about these different areas of life, which we're going to talk about in a moment, and also to live a more satisfying lifestyle overall. What I like about this sort of perspective is that it focuses on what people can do. So I've worked in nursing homes, I've worked in state psychiatric hospitals, I consulted at Hagedorn Psychiatric Hospital, which was a geriatric state psychiatric hospital. So I've worked with some people who have a lot of health conditions, a lot of mental health conditions over the years, and I still go forward, and I imagine we are all here and we do as well, to how can we actually help people live the life that they want despite any of their health conditions or mental health conditions. And I think that wellness is really helpful in terms of promoting emotional well-being as well. So that's our definition that we're going to start out with. I know it can be a little bit weird sometimes because everything is wellness. You know, I have some pets. My pets have wellness food. I go to the wellness center, which is actually a gym. You know, wellness is in there's probably wellness ice cream. I don't know. So that word wellness is pretty much everywhere and overused, in my opinion, because in my opinion, I sort of think about it very narrowly as this kind of idea of that we're choosing to move forward and age well and live well and take these actions towards wellness. So I'm sorry, no elephant was injured in this picture. There was no injuring of elephants, but I thought it was a great kind of depiction of wellness is action. It's movement of some kind. And this quote is really from the National Wellness Institute, which is another interesting organization that focuses on wellness, mostly workplace wellness. So, and they've done a lot of stuff with college students as well. So wellness is movement. It's taking steps each day to move forward in one's life. And I think that's another aspect as, working with older adults, to encourage them to believe in themselves, to seek and find things and resources that will help them live well in different areas in life. So I always think that, wellness is a active process. It's not a sit back and I can't do wellness for you, you can't do wellness for me. Rather, we can talk about wellness and we can identify our strengths, challenges, resources, and needs, and then move towards greater wellness in some way. Now, I do want to say that I am in the Department of Psychiatric Rehabilitation, which Kathy mentioned, and that field is all about helping people recover. We're mostly focused on people who've lived with lifelong emotional health conditions, recover and achieve recovery and live the life that they want. And I think that those ideas of recovery, it's kind of an important concept for wellness in a way. I think that we're all recovering or have recovered from something in our lives. And that could be a difficult life situation. It could be losing a job or losing a family member or going through a very difficult situation. So in many ways, I think older adults are also recovering from something as they age. And sometimes we need to sort of gather what we can from them to help them sort of move forward. Because we know that emotional health is really complex and challenging. I'm assuming that I'm talking to a lot of folks who work in some way with the emotional well-being of older adults. And the literature out there is really, really critical and complex, and saying that well-being is related to physical health. So people who have good health are typically emotionally doing better. As well as social isolation, we know is a big contributor to emotional well-being or takes away, and social support really contributes to emotional well-being. So emotional health as we age is very complex, and there's a lot of elements to it: health, environment, a lot of different aspects. And it really requires engagement, those actions that I mentioned in different areas of life, to bring about overall wellness. Lastly, there are resources and supports. And I'm assuming that we're all in this room because in some way we provide resources and supports to older adults. And we are sort of the champions for emotional well-being. And many of us may say, well, you know what? I don't work in mental health. That's not really my role necessarily. And yet, because mental health is so complex, it really requires the involvement of everyone from, and I think we all know this, but housing providers, meal providers, congregate services, any of those services, we're all engaged with older adults. We're all helping them and thinking and knowing when they're struggling emotionally. So let's talk about this idea of, the other thing I did want to mention is that emotional health is really also sort of related to self-esteem and the sense of agency and self-efficacy that a person feels. And as people age, sometimes they lose that sense of self-efficacy. I can't do what I used to be able to do, or I need more help doing what I used to be able to do. And they don't feel very positive about their aging experience, or they don't feel that they're sort of aging well in some way, which causes some anxiety and sometimes depression. All right. And so let's now talk about multidimensional wellness. again, I'm drawing from the work of some of my colleagues that I've sort of absorbed and sort of crystallized into some other ways of thinking for myself. So multidimensional wellness is really this holistic, person-centered clinical approach that looks at all the areas of one's life. And we're going to get to some of the models. And when I say all areas, you'll know what I mean. But it's really also a focus on strengths and resilience and recovery, how to help people live that life they want and take action. And I know that that's really a challenge, particularly for people who've had a lot of emotional health issues over the years. Feeling motivated and engaged is really a challenge. And there are, some strategies that can get people engaged. And I think the most important thing is to really get into what's important to the person and how can we support them with what's important to them. So the first wellness model that I want to talk to you about is something that the Substance Abuse and Mental Health Services Administration came out with. And this model of these different circles, it was the dimensions, I think it's the 9 dimensions of wellness. And this was adapted from my mentor, Dr. Swarbrick. And you can see it includes emotional well-being, spiritual well-being, intellectual well-being, physical, environmental, financial, occupational, and social. We're going to talk a little bit more about those in a moment, and there are slight differences. There are many different wellness models. I don't pretend that any one is better than another, but what I always encourage myself to do and challenge myself to do, and I encourage you and challenge you to do, is when you're thinking about these wellness dimensions, to think about how does this connect to the population that I support? Like, what are the challenges? What are the strengths? And how can we help people take that next step? The dimensions are really interconnected and they build on each other. What I like to think about in terms of wellness is that it's always a circle. It's always a circle. And as a young person, for my example would be when I work too much, my occupational wellness may be really great because I'm working too much, but my social life takes a toll. My spiritual life takes a toll. My physical life takes a toll. So then I'm not a circle anymore. I've turned into a flat line. And if we think about an older adult, if they're spending a lot of their energy and time managing physical health conditions and their physical well-being, that might come to it might impact their other areas of wellness, including their social or emotional or spiritual or financial. All those areas may not be very well tended if you're getting stuck on one area. But it's kind of hard to say, where does physical begin and where does any of these other areas end? Like when I was mentioning physical wellness and talking about financial wellness, I'm sure that we all went, oh yes, physical and financial wellness are often go hand in hand, right? Because that would be things that people can do and out-of-pocket costs and medications, et cetera. That is really something that will get in the way of financial well-being. So being creative and thinking about how these things can work together is really important. So this model was really created for people living with mental health conditions for many years. So my research question, the thought that I came up with was, how can we help older adults with their emotional health, focusing on the issues of aging much more than the many of the other models focused on work and the importance of work. And for some older adults, work is very important. And for many others, it's not important. So thinking about the unique needs of older adults, I really dug into this question and I spent way too much time. This is what happens when you're in academia. You spend way too much time in something that is like, really, did I need to? Anyway, but I spent 3 years with 5 of my colleagues and we came up with a new model. That's the short of it and long of it. So I really want to gratefully acknowledge both Dr. Swarbrick and my colleague, Dr. Matt Fullen from Virginia Tech, has been thinking about wellness for older adults. And what I did is I really said, there needs to be an intersection for emotional well-being for people who have maybe some other health issues going on who are also aging. So I tried to bring these 2 models together. And after 3 years, we came up with these new ideas, basically, which weren't really that new, but you'll see they kind of fit, I think, a little bit better for many of our populations. And I think that you can add dimensions, and I've seen some other models recently that came up as well. So one of the most important, I think, for emotional health in older adults is developmental. And we're going to talk about that in a moment, kind of go over each of what that actually means. But in a nutshell, that's how does the person feel about aging, and how are they aging? Are they aging well? Are they sort of developmentally? And I, for those of you who studied psychology at some point, the Erickson, sort of you go through the stages in life and the development, it kind of makes sense. And when I think about people who have a lot of health conditions, sometimes that developmental wellness is different. It's a different trajectory when someone has lived with chronic health conditions or mental health conditions all of their life. That experience is very different, and their developmental trajectory is a little bit different than someone who hasn't had a lot of chronic conditions. We then talk about cognitive wellness, which I'll talk about in a second, which is probably obvious, related to the brain. Physical, which is the same. Emotional, like also the same. Social, which is the same. Occupational, and I'll talk about that again in a second, but thinking about that more of from an occupational therapist perspective, which is how do we structure and organize our day? And if I think about the older adults, back in the day, I did in-home services, case management. I ran a home delivered program, home delivered meals program. I ran a public guardianship program. So I've worked with older adults clinically a while back, but I can remember that many of them really struggled with, what do I do with myself during the day? And that sense of purpose and meaning, I think, is really, really important to emotional health, which kind of leads us to spiritual, which we'll talk about in a second, and environmental and financial. So these are the dimensions that I want to sort of dig into a little bit more. Now, if you have questions, I welcome them in the chat. I know that Kathy is monitoring the chat, so feel free. If you have questions, you could also unmute and ask me a question. We've got a small enough group that's fine as well. So let's dig into these dimensions a little bit more. As I mentioned, there is the developmental, I think, is really the pinnacle of the wellness for most older adults, to really be, where are they at in terms of aging? Are they feeling comfortable with where they're at? And, there's a big debate in gerontology about healthy versus positive aging. I don't really want to get into that too much, except to say that we all should find a way to be comfortable with our aging process. And that might take some talking to a therapist or a counselor, or it might mean helping the person sort of do some life review, etc. But thinking about a realistic idea of what aging is looking like. The next dimension is cognitive, which is so important as we age. And coming from it, an emotional well-being perspective, thinking about resilience and control, like what control does the older person have? Self-efficacy, as I mentioned earlier, and engagement in those cognitive activities that keep us going. And just like, the puzzles and Sudoku and what's the new word thing? Wordle. I'm just such an addict to Wordle right now. All those things, learning new languages, all those things really promote wellness for people as we age, everyone, and it improves emotional well-being to keep active mentally. Physical habits, it's just very clear that there's this interdependence between physical and emotional well-being. So nutrition influences our emotional well-being, which we probably see. So people, have poor dentition or bad teeth, or their dentures don't fit, or they've lost their dentures, or they need dentures, and they're eating soft foods. That can lead to people sometimes eating too many carbohydrates and not enough vegetables. Also exercise, and I always hesitate to say exercise because that's also just, it can mean movement. And there's a thing now I did my dissertation on exercise, predicting exercise in populations with people who have mental illness. And there's a thing called sedentary behavior, which is like where we sit. And most of us sit too much. I know I sit way too much. After the post-pandemic, I'm sitting way more than I ever did. And there's a lot of research now that suggests that sedentary behavior is as bad for your health as smoking a pack of cigarettes a day. So helping the people that we support to think about exercise not as like go out to a gym and do jumping jacks, because while that might be great for some folks, other folks, me included, that's not going to motivate me, and it's not really what's going to make me healthy because I'm not going to stick to it. But for emotional well-being, there's research even from the University of Pittsburgh that came out, gosh, I want to say 7 years or something, so promising, looking at folks who have the genetic carrier for dementia, for Alzheimer's type dementia. Walking 20 minutes 3 times a week was enough to start rebuilding some synapses and connections in the frontal part of the brain, which is really, really promising. So, if someone's able to walk, that's great. If they can't walk, maybe there are other movements that they can take that and there's so much evidence that for people with mild to moderate depression, walking alone is as effective for many people as taking medication. So movement is really critical to our emotional well-being as we age and at every age, and healthcare, of course. And even acknowledging the presence of disability, that's never an easy thing to admit or acknowledge, but sort of coming to grips with that idea of disability or chronic illness, and then being willing to accept the supports or adaptations that can help the person live a full life. That is really empowering and helps with emotional well-being. Emotional well-being, of course. We're talking about emotional wellness, emotional well-being, but I wanted to define it a little bit so we're all on the same page. Like being able to express feelings, being able to regulate one's emotions. Sometimes people, as they age, there's a lot of frustration and anger, and it's like, what do we do with that anger? And how can people sort of manage that without it's sort of falling out sideways when, we're not sort of on track with our emotional well-being? Sometimes that comes out on, the people that we love or in other ways. And also emotional wellness is about coping with any stress or trauma that the person may have experienced. Lastly, on this slide, talking about social wellness. And I think that's probably an area that we're all experts in. We probably help people every day with this area, and that includes building and maintaining meaningful and reciprocal relationships. Really thinking about how can the older adults that we support really provide some kind of meaningful interactions just as themselves, so that they're not always the recipient of a social interaction, but they're also able to offer something to other people. And that includes things like social engagements, like, functions and outings, social interactions, building one's social networks, and also giving and receiving social support. And feel free, again, if you have questions, drop them in the chat. If you want me to go over something a little further, I'm happy to do that as well. And then let's talk about this occupational wellness. As I mentioned, I love this idea from occupational therapy. I love occupational therapists. I don't know if we have got any in the audience. You all are awesome. But occupational therapists are really helpful in people identifying goals, in identifying meaning-directed activities. And when I say that, I think about older adults, maybe living in some kind of supported housing or, in a, whether it's long-term care or assisted living. Why do they get up in the morning? What is it? What are the activities or the schedule that's important to them? It's so important to make sure that people have that reason to get up every day. And I think that this session is being recorded. I thank you for the question. And yes, I'm happy to share my slides. I'll send them to Kathy, and I think she'll have a way.
And we'll email it out to everybody who registered. So even if you missed the beginning or if someone was able to make it, we will be sending that out. Thank you.
Yeah. So occupational wellness is actually really important. And for some older adults, they may want or need to work. And I don't want to dismiss that. And others may really want or need to have a purposeful activity each day. That might be volunteering. It might be a formal volunteer role or an informal volunteer role. Could be, the person who, and you probably have these folks in the services that you offer, that person who's always there to help you set up bingo, or the person who brings coffee or helps you distribute coffee when that's, or whatever. It's just making sure that someone has a reason to get up every day. And that's really critical to emotional well-being. I'm starting to think in the research that I've done that meaning and purpose is actually more important than a lot of these other areas to emotional well-being, because without meaning and purpose, it's really, really, people tend to get very depressed. Which leads me to spiritual wellness. And I think about it from a secular perspective, meaning a non-religious perspective. And I think about what gives us meaning and purpose each day. How do we connect to something bigger than ourselves? For many of us, that may mean connections to a faith or a religious community. For others, it may be, walking outside or volunteer work and a host of other things. Getting to know what an older adult's values are and what they think is important is really, really key. Kathy, did you have?
Yeah, I just wanted to ask, we see more and more reports or things on the news that, America is becoming less religious. So while people who are now retired are more likely to have been part of the faith-based community, gone to church or congregation, that younger people don't. And that seems like that will have a huge impact on people's lives if they don't have that resource and network to go to. And I was wondering if you have any thoughts on that.
That's a really great question. I don't know that I've read a lot. I kind of know what I know, and I don't want to sort of dance around on something that I don't know. All I can say is that the literature is very, very clear that engagement in spiritual activities, again, from faith-based or spiritual non-faith-based activities, really contribute to people's emotional well-being. And I would guess, I could speculate that that will be harder as people age. The other thing that's really important about what you said, Kathy, that strikes me is that we're aging every day, right? When do we begin aging? We begin aging at birth. So I've been thinking, I'm not going to reveal my age, as one never does, but thinking now more and more about how do I want to be in 10 years? How do I want to be in 20 years? And that might be an interesting conversation to have with some of the older adults that you're working with. How would you like to be next year? How would you like to be in the next 5 years? What would you like to be able to do, or what's important to you? And that gets at some of these values-based discussions as well. And so for the next dimension, environmental wellness, it's sort of like, what? But when you think about it, it kind of makes sense. Environmental wellness is really the creation of positive and healthy living and learning spaces in any surroundings to support positive aging and independence. And I think that can be challenging sometimes. And I think that we're probably all in services, I say we, I mean you all, are in age-friendly environments. And when we think about age-friendly environments or communities, that's really something that integrates the physical and social environments within a model of participatory collaborative governance, so that there's sort of this engagement of people are really involved in these discussions, and it's open and accessible to everyone. I also think about what brings you joy. So I shared this anecdote at another event recently, but when I was working at the state psychiatric, when I worked at Hagedorn, which was a geriatric psychiatric hospital, I ran a group about wellness. We were talking about environmental wellness. And people were sort of like, I don't have any environmental wellness right now. I'm in the hospital, and look at these cinder block walls. And we were all sort of like, yeah, wow, that's rough. And then someone else pointed to me and they were like, look out the window. And I looked out the window, and that hospital was up on a mountain and overlooked a valley with a river. And they said, every night I come at sunset and I watch the sunset and I watch the deer come out. And I was like, wow, that's really powerful, because we were talking about how to make things in your environment support your well-being. And that person described beautifully and eloquently what environmental wellness could look like in a setting that wouldn't typically be beautiful. When someone lives in their own apartment, they may have art on the walls, they may have plants, they may paint their walls a fun color, but it does influences emotional health. There's a whole nother body of psychology that looks at environment and space and how it relates to our mood. So I see some points here. I want to go back to the research says about how spiritual we are as a country can be different than religion. Yeah, that's a really good point. There is a difference between spirituality and religion. And I think that we need to be mindful and aware as providers of service that people may, and it's important to ask both questions. I really strongly believe that it's important to know about someone's spiritual wellness and say, what are you doing for your spiritual wellness? And again, sort of putting it in that context of it could be anything that gives you meaning and purpose. It might be your faith. It might be your religion. It might be some other spiritual activity. Some people consider meditating or walking in the woods or being in nature as part of their spiritual activity, which is not religious based, but it gives them a sense of meaning and purpose. So really understanding that. So offering social support, is that the same as providing coffee or other examples? Social support is really a tricky thing, and it's sort of how the person receives it. It could be offering coffee. It could also be asking someone, how are you doing today? Making eye contact, or noticing when someone doesn't seem to be doing well and taking them aside and saying, hey, you're not acting like yourself. I'm a little concerned. How are things going for you? And it depends on your location, your role, what is typical about that. The other way I'm giving you suggestions and thoughts about a provider role, but you can also encourage the person to ask themselves, are you getting the social connections that you need? And if the answer is no, you might be able to problem solve with them and say, what are some of your interests? Where do you talk to people? Where can you connect with people? And then sort of problem solve that and practice. Some of the hardest groups I've ever had to run, if you all have ever run groups, but is social support groups. It's like talking, making new friends, and how do you start a conversation? And if you're interested in meeting someone, how do you introduce yourself in a fun way? Those are sort of difficult conversations. There are some great worksheets on the internet. If you just Google social skills groups, there's a lot of examples of that. And there's a book in particular, if anyone's really interested in social support, there's a great, it's for people with schizophrenia, but it's applicable to anyone in any way, because it's these very basic social skills of how do you talk to your doctor? How do you ask a question of your doctor? How do you say no to a request? Things like that. There's some great resources out there. And environmental wellness. Oh, thank you so much for bringing that idea of socioeconomic factors. Are there any particular social services among those of lower SES that significantly improved wellness? That is such a wonderful question. I'm so glad you brought it up. And I think I'm embarrassed to say I don't know a lot about that area. And one reason is I think that we're still looking at and thinking about wellness. What I can tell you is there has recently been some research looking at access to green spaces for people who are in a lower SES category. So having some access to grass and trees and being outdoors is very helpful for emotional well-being. And other areas, that's work that desperately needs to be done and looked at. I think also faith there's some, now that I think about it, there is some research that's been done on spiritual wellness in people of lower SES and folks living, challenged by finances, or I think the other sort of elephant in the room, which I think really contributes to emotional well-being, is this intersectionality. And that is for people who may have experienced stigma or discrimination, and also poverty and or emotional health challenges or other disabilities. That intersection of all of those challenges, I think, really, really negatively contributes to emotional well-being. People really struggle with that. And it's, I think, an area that we need a lot more research and a lot more information about how to best address these intersectional issues. So definitely receiving and giving. I'll just give you a quick example. I have a 97-year-old grandmother who has dementia, and recently I visit her and she asks me, the same question over and over: how am I doing? How's my husband doing? And I was thinking last time, I thought, I need to do something with her. So we made a pie together, which is something she and I did for all my life, and was amazing to me. She felt, I could just see her body, her stance. She was so proud of something she had done and actually engaged in something. So finding opportunities to help people, particularly when they have disabilities or dementia or other chronic health conditions, those opportunities to give back. That's a valued social role, just like being a parent or a daughter or member of a church or a singer in the choir. Being a friend is a valued social role, and that's really, really important to support people, those opportunities. So we went on a little sidetrack there, but I'm really glad we did, because you're bringing up some really, really important topics that the literature on emotional well-being for people with different kinds of conditions or in different unique settings is limited. So, and the research on wellness for people who are older adults and wellness, this is an emerging area. So you all are bringing up some great thoughts. I appreciate it, because you're making me think, Michelle, I see some research that needs to happen, and some people that I need to connect with about that. So I appreciate that. And lastly, we talked about this a little bit, but financial wellness, finding those resources to meet those practical needs. And I know that poverty is a huge issue in older adulthood, and also for people with disabilities of any kind. So finding those resources, and I'm sure that you all are people who are constantly connecting people to the different resources out there. And then trying to overcome any kind of impact of a lifetime of poverty and discrimination or underemployment. So again, sort of thinking about what would it take, and making sure that people find their sense of self and value in themselves as they age, as people with great wisdom. I think that for people who've had chronic conditions of any kind who age, I think, these are folks who often are survivors. They've gotten through a lot of really difficult situations, and here they are. And now how do we help them sort of have that perspective of, I've arrived, I am healthy and well despite all of these difficulties I've experienced in my life. Now I'm going to ask you a question. You guys had some wonderful conversation in the chat going. I'm going to preface this by saying there is no right answer. This is not this is not a quiz. But which wellness dimension do you think is most important for the emotional well-being of the people that you work with? So which of these dimensions that are on the screen are most important to the emotional well-being of your clients? And I think an argument could be made really for any of them. Thank you. So I see some people say financial is a big barrier for sure. It's really hard to have wellness in any area of your life if you are food insecure or housing insecure. Absolutely. And then developmental. Absolutely. So when people are sort of not comfortable aging, I guess, or experiencing a lot of challenges related to aging, it might be really, really hard to feel comfortable in their emotional well-being. And then physical, absolutely. A physical is a huge issue. So if you have a lot of health conditions, new diagnosis, falls, all those things are really, really challenging to emotional well-being. So I'm going to give you a few practical tips. These come from a paper. I told you about my fancy 3-year journey thinking about this. It's interesting to, we all do the work that we love. And I guess this is the work that I love, is thinking about these things deeply. But some practical tips. Developmental, we can work with people to counteract myths, myth busting. I was thinking about ageism and an antidote. How can we build antidotes to ageism? Because it's everywhere, right? We see ageism in the news, we see it in magazines, we hear it from everywhere we go. So helping people really think about aging as a positive experience. Also cultivating hope, that perspective, that, sort of wisdom that can come of going through a lifetime of stuff. We know things as we get older. And then also identifying any strengths that may come up as a result of aging. And by that, I mean, there's a lot of evidence that suggests that older people are much better at problem solving, particularly complex problems. Yes, they may be a little bit slower in solving quick math equations, but for those really complex life problems, that's a strength for sure. And then for cognitive wellness, you can ask people to consider activities for their brain health, whatever that is, and finding what people's interests are and encouraging them to sort of lean into that a little bit. And focusing on curiosity and learning and resilience. That's so good for one's brain as one gets older. And you probably, in your work, you probably know the folks who are aging well or developmentally well, because those are the folks who are engaged, who are doing things, are coming up with something new every day. And then you could probably also on the other side think about some people that you've worked with who really struggle in this area and have sort of shut down and don't want to learn anything new, which is pretty true of anyone at any age. But it doesn't help us age in a healthy manner if we sort of put our head in the sand like an ostrich. I mean, I say that to myself as well. And I probably wrote the least practical tips about physical, because I feel like most of us probably know that the best, the physical wellness, but really focusing in on healthy habits and routines. As I mentioned, getting adequate nutrition and healthy food, nutritional foods, and also movement, and staying on top of preventative care and helping people access the resources they need and insurances they need to get the services that are needed. Some practical tips for emotional wellness are really encouraging people to express their feelings in an appropriate way, of course. But if people are really angry or they have a lot of, negative emotions, that might be the time to say, you've got all these negative emotions. It might really help if you talk to someone. Or again, physical activity is something that helps dispel some of that energy of negative emotions. Also to help encourage people for strategies to build hope, to have some hope for their life, that they can live the life that they would like or close to what they would like right now or in the future. And also to learn some new coping skills. And I know that a lot of you all are doing some wonderful work in aging programs to help people learn new coping skills. So that's really amazing. Some practical tips on social wellness is helping people find new ways to connect with others. And that could be like finding their area of interest. So, if someone has a hobby or someone wants to learn a new language or something like that, they can connect with others. And occupational, I think we talked about that, asking people to come up with a list of things they do or kind of build a schedule for themselves so that they feel that they have purpose and meaning each day. And then for spiritual wellness, you can explore meaning and values. You can identify ways to build resilience and flourishing. And one of the sites that I really love is the Greater Good Science Center from University of California at Berkeley. They've got a whole website dedicated to building resilience and flourishing. And it's simple things like three good things, which is an example of what are three good things that happened to you today. And that just doing that activity every day actually builds positive mood. So that's a simple thing that doesn't cost any money, that is actually research-based and effective in helping people feel better. For the environment, you could ask people about their satisfaction with their surroundings, although you may not want to hear the answer, or maybe ask them how they might change their surroundings to make them more supportive to their well-being, and create spaces and places that encourage wellness. And I imagine you do this already. You may have wellness rooms or wellness corners that promote health, and that's wonderful. And then for financial wellness, really identifying any resources, skills, or supports that a person may need to build that area. It also may mean that we need to advocate on behalf of someone or help someone advocate for themselves if they need additional resources for food or for housing or for monthly income, things of that nature. Phew. All right. So we got through all the dimensions. Thank you for hanging in there with me. Where do we start? So I did, as I mentioned, worked as a social worker. So I'm always like, come on, Michelle, let's not be all theoretical here. Let's make sure we're really, what do we do with all this information? I think having discussions with older adults is really key. Asking them about these different areas, just like, there's this interesting idea about wellness, which means that you sort of have balance and you take action every day. What do you think about that? What do you think keeps you well every day? And what might you want to try more of? You can also ask your clients to rate each dimension, where they are now and where they would like to be maybe next month. You could give it a numeric value like 1 to 5 or something like that, or just talk it through. You might, I know, you're going to shoot me, but I'm going to, one idea would be to consider adding wellness dimensions to your assessments, which is more work, but you can consider it and say immediately no, or hey, maybe we could consider some version of this. And then I also really encourage you to reassess periodically or following significant events, because the truth about wellness is, and for emotional well-being, it fluctuates, right? If somebody gets a new diagnosis, their wellness is going to suffer in a lot of other ways, not just physical wellness, but probably their emotional wellness in other areas, maybe spiritual wellness as well. And also, just people change and evolve, and things change from, this to 6 months from now. It's a little bit hard to know what's going to be happening. So those are some ideas that I came up with to be very practical and applied. How might you use this in your work? But I'd love to hear from you now about how you might use some of these ideas that we've just talked about in your practice, in your settings. You can feel free to unmute. You can put in the chat. Kathy, do you want to navigate that with me? Or I think you're muted.
Yeah, it helps if I unmute myself. So if you want to unmute, if you're not able to do that, I will read them off from the chat, or feel free to, turn on your sound and join in.
And I will say, I welcome anyone's thoughts about how you might use some of these concepts today. I will say that I have noticed in the last 4 years or so that a lot of senior communities, like across nationally, are using the wellness model or a version of wellness in their settings. So that's sort of interesting. And they typically use a simplified 6-domain version.
Adrian has her hand raised. Are you able to unmute yourself, Adrian, or do I need to do that for you?
So I was dropping my daughter off at 2:30, picking her up from school at 2:30. So that's why we're in and out, because the connection is bad. But everything you said is what I do, and so it's just confirmation that I'm on the right path, and in gratitude. One of the things that I do is, which I find, sometimes you give them this packet of information, and what I really want to know is they complete a survey on who was the person, who are they now, who would they like to be with the proper supports. And that just, if you don't the other information I'll get the signatures, but just walking in the door, I want to know who were they, and then of course I always tell the adult children, who is usually the ones who hire me, that chances are I'm gonna find out things that are not in there, because I'm gonna build that relationship. But finding out who they were, who would they like to be, with the proper support is, it just, it's like building they talk about equality, and equality to me is giving everybody the right size brick to stand up on to be able to oversee the fence. And so a person who is taller, who may not need as much support, you kind of know that balance. So you give them a little support so that way they don't lose their autonomy or their sense of being in control. And if someone needs a bigger brick, then you give them the bigger brick so they can see over the fence. And so again, I'm glad I tapped into this, because it really is, just confirmation. Because sometimes when you're a solo entrepreneur, you're kind of out there by yourself, and you're hoping, you're praying, you're doing the right thing, you're doing the research. So I just thank you for that. And I mean that. Thank you.
Well, thank you so much, Adrienne. I appreciate you sharing. And I love that sort of image of what size brick do you need to sort of, Kathy, you just said the same thing. Yeah, what size brick do you need, and what supports do you need? And I think that for many older adults, that's just such a challenge, right? To first of all, not only see the challenges that they're facing, but also the strengths they have, the wisdom, the knowledge, who they are as a person is valuable, and what they have to offer is valuable. So, Adrienne, I'm grateful for you for the work that you're doing and trying really hard to see people as a whole person, because I think that, I could say that when I was 25 and working in aging services, I had a very different view of, like seeing people for the problem that they came in with, because I was 25, and as I've matured, I certainly now value and see how important it is that we have to see people from a whole perspective. So thank you for that. Anyone else? Thank you.
I'll share one more thing. I was about to type it, but I like how you talked about the life reviews too, because one of the things that I say is that when you walk into my clients' homes, I don't want you to just see the disease process that they're experiencing. And the life review does that. It takes away where, of course, the disease process is there, or the decline or whatever, but you don't want that to be the first thing you see. And talking about like all their contributions and, reiterating it, all their, all the work that they have done in the world really minimizes the focus of seeing that disease process before you see that person. So that was a really good point as well.
Anybody else? Michelle, they're either shy or you were very, very thorough.
Or it could be that it's 2:55. I don't know. Well, yeah. So the multidimensional wellness has been used in a lot of different settings. And Adrienne, you gave some wonderful examples of how you're thinking about the whole person. And I've seen it used in long-term care. I've seen it used in assisted living. I've seen it used in congregate housing. And the way that it's been used is offering some wellness assessments. Like I love using the tools where people self-assess and then we walk through it. I see Adrienne has another point.
I knew it was something. I turned 50 this year, so I'm not so I can't remember everything right away. But I think one of the things that you also brought up that was a really good point, and I'm not talking from a high horse when I say this, but there's a lot of ageism even in healthcare, and we really have to, self-assess and check ourselves and our biases, because there really is a lot of it. Like we need to look at the research and look at the human being and the people that we're serving. But people come to work, even in this field, thinking that they can't when they can, or maybe can, or probably can, or whatever. But
Thank you for that point. It's unfortunately true.
No,
And how could we
Kevin
not
has a-
be?
Kevin has a comment. Can you unmute yourself, or do you want me to do it for you?
I could
ahead,
unmute
Kevin.
myself. So I just want to share that recently I'm going to church, not because I'm religious, because I found a church in my area where they teach Bible lesson, but they also have a meal to share where you could, talk and you gather. And what turns me out to that church is that they serve cappuccino. I walk in there, you could have any kind of coffee you want, and they have a live band to start off the service. So to me, it's like getting into another, it gets me out of the house, it gets me into networking, it gets me to hang around people. And I found people in the church are so nice. Everybody has so well mannered and they're so friendly. So, that's another aspect I'm glad I found. Thank you.
Thank you for sharing, Kevin. And I think you brought up the great point that you can really get a lot of needs met in different settings. And you might find a church, or you might find a community center or a senior center that offers a lot of different aspects, and it can really touch a person's wellness. If there's food involved, I know my background and my culture always says bring food, that's always gonna, help the emotional wellness. And when I used to go give some difficult talks at the state hospitals, I always brought cookies because I believed firmly that was a way to promote wellness, or not. But anyway, I do want to leave you. I know some of you are working in the field, and you were probably dying. You're saying, Michelle, how in the world can you do some kind of wellness assessment? Well, I have a list of free wellness assessments that you can look at. Some of them are targeted in different ways, but if you are interested in using some kind of wellness assessment for emotional well-being, you click on any of these and you'll find use for them. Also, I do just want to point out the last two are from Peggy Swarbrick, who really has been thinking about this for many years. The one in wellness and recovery is targeted a little bit more to addiction, but it doesn't actually have a lot of the language of addiction in it. So I'd encourage you to look at all of them and sort of see what you might like, what you might leave behind, but different ways to engage people, to talk to people, to ask people questions. So if there are any other questions or comments, you can let us know. That's my contact information if you want to reach me. And I do want to make sure that we have some mental health resources in case anyone needs them. You probably have this information, but I feel it's my duty to make sure that people have some information. 988 is the new mental health crisis hotline for the country. It's running very well. In New Jersey, you can dial 211 for a lot of assistance from United Way, also NAMI, MHA, UBHC, and then I do some work with COPSA and the Care to Caregivers program, and I think they do a fabulous job supporting caregivers and the needs that they have. So thank you, everyone. It's been really a pleasure to be with you.
Thank you, Michelle. And Michelle is also the guest on our upcoming Aging Insights, which will be available on YouTube. It'll be available through our website, or it might be on your local cable channel, but that should be up by November 1st. So I really want to thank you again for joining us today and for sharing this. I know it's very enlightening for not only work, but for personal use and perspective, so that we can relate better to the older adults in our lives. And we will send out the recording and the slides. And again, thank you for joining us today. And I hope you enjoy the rest. Perfect timing. The lawnmower guy just arrived, is making a lot of noise in my background. So thank you all.